Welcome to Module A1. This session is an introduction of pharmacogenetics, its clinical utility, and implementation. It is well recognized that many medications exhibit a wide inter-individual variability in their efficacy. A large part of this variability is due to inherited differences in the drug conversion pathways. Pharmacogenetics is the study of these inherited genetic differences in drug conversion pathways and investigates how genetic variations affect an individual's response to medication. The goal of pharmacogenetic analysis is to adjust a medication regime that maximizes benefits and minimizes risk of side effects. Pharmacogenetics enables predicting drug efficacy, identifying optimal treatment, preventing adverse effects, and reducing trial and error prescribing. Pharmacogenetics was pioneered for personalized prescribing in cancer treatment or oncology. Soon, it was being utilized to identify patients who were more likely or less likely to benefit from specific medications. Pharmacogenetics is currently being implemented clinically for chronic diseases. Here's a brief historical overview of pharmacogenetics. In the 1970s, though much progress had been made in the treatment of breast cancer, physicians didn't understand why some patients responded better to treatment than others. Then, in the 1980s, there was a breakthrough discovery. Scientists discovered that the HER2 receptor, a cell growth regulating gene, is overexpressed in some breast cancer patients. These patients had abnormal expression of the HER2 receptors. The HER2 receptor drives cancer cells to divide more rapidly. Patients with HER2 overexpression faced a grim reality. Their cancer would not respond well to conventional chemotherapy and recur earlier, and survival rates were much lower. This type of breast cancer is now known as HER2 positive. A monoclonal antibody called Herceptin was developed to block the HER2 receptor's ability to drive cancer cells to divide rapidly, slowing the progression of HER2 positive breast cancers. The FDA approval of Herceptin in 1998 made Herceptin the first ever personalized treatment for breast cancer. Today, patients diagnosed with breast cancer undergo genetic testing for HER2 overexpression. We now know that around 20 to 25% of all breast cancer patients are HER2 positive. Treating these patients with Herceptin means that a HER2 positive diagnosis no longer means a lower survival rate. The success of Herceptin has accelerated the introduction of personalized medicine and pharmacogenetics in other diseases. Today, up to 50% of all new medications have a companion diagnostics to improve accuracy and safety of the treatment. Let's go over some examples of the utility of pharmacogenetics in chronic disorders such as cardiovascular diseases. We will focus on two commonly prescribed medications and the enzymes responsible for metabolizing these medications. Clopidogrel prevents blood clot formation and is primarily processed by the liver enzyme CYP2C19. Genetic variations in the CYP2C19 gene affect the clinical efficacy of clopidogrel. Some people may have a slightly increased risk of bleeding due to excessive drug efficacy, while others are unknowingly remaining at high risk of stroke and heart attack. Similarly, mutations in SLC01B1 can determine the risk of statin-induced myopathy, which is a common complication in use of statins leading to muscle pain. Pharmacogenetics can be a useful tool when physicians prescribe Plavix or clopidogrel. Patients with an active CYP2C19 enzyme successfully convert clopidogrel to the active metabolite and achieve therapeutic response. Patients with low levels of CYP2C19 activity or a non-functional CYP2C19 enzyme cannot convert clopidogrel to the active metabolite, which means these patients remain at high risk for cardiovascular events. Genetic testing can determine whether clopidogrel is effective for a patient or if the patient requires alternative medication. Pharmacogenetics can help identify patients who might suffer from side effects of statins. High cholesterol is a common problem in the general population. It can be treated by making changes in lifestyle and with statin therapy. However, 18% of patients on statin therapy develop a serious side effect called statin-induced myopathy, causing muscle weakness and elevated creatinine kinase levels, especially at higher doses of statins. It turns out that statin-induced myopathy is due to a common variation in the SLCO1b1 gene, which codes for an enzyme which metabolizes statins. Patients carrying this variation have higher concentrations of statin in the blood. Pharmacogenetic testing can identify patients at high risk of myopathy before the initiation of therapy. A pharmacogenetic test can help alert physicians to patients who are at risk and will require a lower starting dose of statins or alternative treatment. In summary, drug response varies from person to person. Pharmacogenetics can predict an individual's response to medication and help physicians and pharmacists personalize medication regimens. The benefits of pharmacogenetics are recognized worldwide, and many leading healthcare systems have incorporated pharmacogenetics testing in their clinical practice. Leading healthcare institutions are implementing pharmacogenetics testing. The list includes Pharmacy Association in British Columbia, the Montreal Heart Institute, the Mayo Clinic, CAMH in Toronto, St. Jude's Hospital, the Vanderbilt Medical Center, and the University of Florida Health System. These institutions have implemented various pharmacogenetics programs covering a range of therapeutic areas, including pain, cardiovascular, mental health, oncology, and immunology. Here are some of the exciting results. Mayo Clinic successfully incorporated pharmacogenetics-based prescribing in patients' electronic medical records. St. Jude's found that more than 1/5 of the patients tested had one or more high-risk variations in enzymes which metabolize medications, leading to dose changes. Vanderbilt predicted that their program helped avoid close to 400 significant adverse drug events in a 5-year period. Overall, implementation of pharmacogenetics helped improve patient safety and reduced overall healthcare costs.